This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Living with type 1 diabetes can be challenging, but it is manageable. Dr. Huson at Mercy Health shows us that in addition to treatment options, maintaining a healthy lifestyle can make all the difference.
My name is Tamara Huson, and I'm a family medicine physician here at Mercy Health. If we think about the body having different organs and all the organs are assigned different jobs, the pancreas is kind of in the middle of the body, and it's essentially in charge of lots of different things, but one of them is producing insulin. If you think about putting food in your body and what happens to that, it's very similar to when we put gas in a car and some magic machinery in the car turns that into energy so that the car can go. In our cells, insulin does a very, very similar thing. When you put food in your body, insulin is kind of the magic thing that in your cells makes your body go. And the pancreas is kind of in charge of making insulin. Type 1 diabetes happens when there's autoantibodies, which is a very fancy way of saying there's little molecules in our body that actually our own bodies make that actually attack the cells in the pancreas that are responsible for making insulin. And then that destruction of those cells means the body can't make as much insulin. So then not having insulin makes it so that you don't have that magic machinery that allows your food that goes in to turn into energy and other things that you needed to do. So type 2 diabetes is overwhelmingly more common. It's 90% of all the diabetes that you hear out there is likely type 2 diabetes. Kind of the way that they differ is type 1 that's the one that you mostly diagnose earlier in age, especially in kiddos. I always make a joke with my patients. It's almost like, a kid with, their headphones on, not listening to mom saying, please do your chores. Like, the insulin's there. It's around. It's trying to say, hey, body, turn the food into energy. But the body's like, no, I'm not going to listen. That's more type 2 diabetes. Type 1 diabetes, there's just not enough insulin to do the job. Believe it or not, they are still very much looking into what other risk factors contribute to type 1 diabetes. So this might be a little boring, like academic stuff, but essentially when they look at the rate at which new cases come about, it's outpacing just genetics. So we know that there are risk factors that likely contribute to getting type 1 diabetes, but those are still all under investigation. So there's 1,000 theories, maybe certain kinds of viruses can increase that risk. So we know that it's not just genetics and some environmental factors can play a part, but nothing that we know conclusively enough for me to say, hey, look out for this. Certainly, you want to do a healthy diet, you want to exercise, you want to avoid tobacco, smoking, alcohol, all of those things, leading a healthy lifestyle. But one of the things that sets type 1 diabetes apart from type 2 diabetes is that type 1 diabetics, because they have that destruction of the cells that cause insulin, they cannot survive without insulin from the outside because their bodies aren't producing it themselves, right? And so type 2 diabetes, there's lots of oral medications, there are injectables that are not insulin, some can even be managed with just diet and exercise and different lifestyle modifications, also insulin sometimes to some degree depending on what has happened in the body, but type 1 is always insulin. Typically you want to do healthy veggies. And I say healthy veggies because sometimes I have patients that are like, I'm eating lots and lots of carrots, which are yummy, but they're kind of sweet, right? So things like broccoli, the green stuff, right? So the broccolis, the green beans, celeries, cauliflower, fruits, like same thing, right? The good fruits. People will often come tell me, oh, I love pineapple. I love like a really ripe banana. Those are super, super sweet and high in lots of sugars, right? So more so like the berries of the world, the apples of the world, and kind of also in moderation, right? Because all those have sugars, they have carbohydrates, even proteins, right? So people who come in and tell me, oh, I eat lots of baked chicken. You also want to do that in moderation because if you're eating an excess amount, your body actually converts that to fat. And some of that fat sometimes can be bad also in diabetes and things like that. It increases some of that insulin demand. At my practice, we do a few things. So one, I try really, really hard to sit down and do really clean, good education with my patients. Try to teach them, if you can only go to your favorite fast food restaurant, tell me what your favorite fast food restaurant is. Let's look at the menu. Let me help you pick what the best thing is. Maybe you can do this salad, skip the dressing, or maybe you can do this, eat half of this, see where your blood sugars are at. Maybe you can eat another half later, hydrate. So we do some of the meet the patient where they are type things. So that's something we do a lot here. I teach them about free apps if they do have a phone that you can calorie count. You can also look at the macros. Macros means, so if you go to your favorite fast food restaurant, it will tell you this particular meal has this many carbohydrates, this many proteins, so that you can keep track of what you're, and a lot of them are free and you don't have to spend any money on them. We of course also have resources at the community level that we do provide every patient every time. I ask, do you need any help to help you afford food, transportation, housing? And if they say, actually, yes, doc, I do, we do have resources for each of those. We also have referrals to our community program so that no patient is kind of out there on their own. And then lastly, we try really, really hard to just like meet patients where they are in their community. So we also do a lot of outreach. We do a lot of volunteering just to help with that advocacy piece too.